Hi everyone, we're just trying out something new. So we're trying to reach out to our audience on the YouTube channel as well. So we are trying to talk about what are the options for weight loss. First of all, at the outset, let me wish all the mothers and a very happy Mother's Day. And so, what are, as you all know, we are all stuck at home, and everybody is sitting at home, not getting enough activity, and therefore they're causing. Um so we're starting to lose our activities and gaining weight, and because of that, we're all feeling bad about it. I'm sure. So, what are the things that you can do? And now, since we are easing up on some of the restrictions that we are having, so what we can do about it? So, most of us have stuck at home, have a lack of activity, and that is one of the major reasons of weight gain. Along with it, yes, you're sitting at home, so you tend to eat a little more, and you start eating all sorts of things. So that's another reason. And for people like me on the wrong side of 40, then your metabolism is slowing down, which is again causing more issues uh, to your weight management problems. So, what are the few things that you can do? First of all, as I mentioned in our other videos, is that we need to be a little more conservative and watch what we eat. So that should help. So watch what you eat in the sense that portion sizes. One. Second thing is what quality of food. So home cooked food better, and of course what you're eating. Avoid junk food, avoid sugars, processed food, and all that, and try and keep it more natural food, more vegetarian food, and so that all will help. Secondly, some amount of physical activity at home. So it could be like just doing some push-ups, or even doing sit-ups, or some kind of an activity, skipping or something like that, which you can do at home, and you don't have to go around too much. And though the restrictions are easing out, but I'm still sure that maybe we might not be able to go back to the gym, or try and you know get into contact sports, or maybe some of the sporting facilities like badminton or something, which might not yet open. So do what you can at home. Simple thing like you can do some weight training and all that, which will not take up too much of space, and it will also help you burn more fat. If you have more muscle bulk, then even during the resting phase, you're burning more fat. So that's the whole premise behind doing weights. So yes, as I said, it's difficult. It's difficult, and we all have we all have gained weight to different extents, I'm sure, and we would like to get back to how we were. So there are a few options that we do. So what are your weight management options that we can help you with? So first and foremost, as I said, is watch what you eat and follow what you're doing, and maintain that, and get some more physical activity into your life. What else can you do is we do something called like once the lockdown is over and everything, and we get back to normal, then yes, as I said, I will also be going on a diet, and we do something called the HCG diet, which I have done before, and it has worked well for me and our patients, and most probably I'll be getting onto that. So the HCG diet is basically, HCG is an hormone produced in the body, especially in women, and that is the hormone that people you test for in the urine when you check for the pregnancy. So that hormone in low doses, in very low doses, along with the caloric restricted high protein diet, gives you very significant weight loss. The advantage of that is, of course, you lose weight, but you lose weight from only specific areas. So you don't lose weight from the face, you don't lose weight from the boobs or the butt, and which is, these are all called structural fat. Structural fat is basically fat which is also providing support. Okay, so that is not lost. Whereas you lose weight from where you need to actually lose weight, and that is why this diet is better. Secondly, you also tend to lose weight from unwanted areas only. So that is the biggest advantage. And then, of course, because it is mobilizing your body fat because of the hormone, because of that, you don't feel hungry and you don't have cravings. So it works very well. It has worked very well for me. So in about 23 days, you can lose anywhere between about 5 to 7 kilos, depending on what kind of a diet you are on. And if it's 40-day program, then you can lose anywhere between about 10 to 11 kilos. And what it also does is it is like a detox for your body as well, because you're detoxing and avoiding a lot of processed food and sugars and all that. So it's like a detox regimen for your body, and you're eating more of veggies and you're eating more of mm, good stuff, and proteins and not unnecessary carbs and sugars and all that. So it's like a detox, and it's also retraining your body to eat and have better things. So that is how it happens. Now the next thing is, what else can you do? The other option is, yes, so that is exercise and diet. As I said, you are what you eat, so that would help. Secondly is to follow, you can do the diet, which is a HCG diet, which can help you. Then thirdly, yes, if people are, another option is to go in for a surgical option. So that is not for weight loss per se, but that is more for an inch loss. It is a more contouring procedure, which is liposuction. So liposuction will help you contour your body. So if there are some hard to lose areas in body which have to be corrected, so then liposuction can help you with that. And then so it can contour your body and you lose more in inches rather than in kilograms. But that is what looks makes you look a lot better once you lose the inches, whatever the weighing scale is saying. So that is another option. The advantage of doing something like that now is, like, many of the people still doing work from home or working from home. So if you're working from home, then yes, it is a good option, because you can do your healing at home during the time where you're working from home as well. So, and there are no people to ask you questions as to how and what happened. And that's what most of the times it happens. People do the lipo and then go back and say, okay, we did your diet or exercise, and that's how we kept fit and all those things. So you could do that as well. So you can take this opportunity during this time, uh, provided your other parameters are all right and you have the time. You could do that. So that can help you. Then, so liposuction is not only for the men, for the women, it is also for the men. So a lot of the men have fat deposits, and we all have a struggle with our paunch or fat deposits in the chest. So liposuction will help you with that as well. So you could do that. So for the male breast or for the abdomen, the lower flanks, that is the sides bulges, which is the love handles, so that it gives you a better proper V shape. So that can be done. And the procedure usually is a daycare procedure. Come in the morning, you go back in the evening, and then what you have to wear a pressure garment, which is like a vest, so that keeps all the skin compressed and doesn't allow it to the swelling to get too bad. And you can get back to all your normal activities in about a week or so. So that should not be too much of a problem. Now, so it can be done for both men as well as women. So it's for the mummies and the daddies. So it's not only for the mummies. Now, talking specifically of mothers, we can say we do something called the mommy makeover. So the mommy makeover is basically a combination of procedures that you do to help regain what you had lost during pregnancy and breastfeeding. So it's basically the loss of the stretch marks, the weight gain, the sagging of the breasts, and all that. So typically, a mommy makeover consists of two things. One is the tummy tuck, which is basically lipoabdominoplasty, where we're doing a liposuction of the sides, lower back, and tightening the tummy, removing the excess skin, removing the stretch marks, tightening the muscle, and getting you back to a flat tummy. And along with it, you can do something for the breasts as well, which is the next most common thing that we do when we talk about a mommy makeover, which is basically it could be breast related. So they can be either you can do a lift, you can do a reduction, you can do a lift plus augmentation or an augmentation. So these are the four things that can be done. So how do you decide what needs to be done? When you wear a bra, if you find that the bra is full, but when you take off the bra, there is a sag, that means you only need a lift. But when you wear the bra and you feel that your bra is empty, and when you take off the bra, there is a sag, then you need an augmentation with a lift. When you're wearing the bra, you feel that it's empty, but when you take off the bra, there isn't too much of a sag, then you need only an augmentation. And if you have the breasts which are large and they're causing pain, dragging sensation in the neck or in the shoulders and everything, then you need a reduction. So this is how you decide up to what you can do. And so the tummy tuck and the breast procedure are combinedly called the mommy makeover, and that is something that you can do. And apart from that, mommy makeover, you have certain other things you can do. You can do something for the pigmentation. You can do some vaginal tightening. You can do some labiaplasty. So those are all ancillary procedures. The main procedures are related to the tummy and the breast. So anybody who's had kids and who's had massive weight loss because of bariatric or anything is a candidate for a tummy tuck. If you're in between kids and waiting that you have had one kid but you want to wait and have another kid, or you need to complete your family before, then we would suggest don't going for a tummy tuck. Just do a simple lipo. So the lipo at least takes care of the fat part. So in the liposuction, the fat is removed. The sagging skin and this loose muscle may not be tightened, but that we can finally tighten once you're finished with your family. So once you're done with your family, you're not having any more kids, that is the time to do a tummy tuck. So, these are some of the options, and as I said, liposuction is good for inch loss, so it can be done for specific areas. So it could be maybe your arms, maybe it could be your thighs, it could be only the hips, it could be only the tummy or the back, and in men it could be only the chest or the abdomen, or maybe the double chin or the neck. So these are a few areas that we normally do liposuction, and most of the patients are, as I said, they're daycare, they go home. So these are a few options that you have for contouring yourself and getting fit. And since many of you might still be working from home, you still have the opportunity. You can take the opportunity and do it now and get healing time. And so that should help you. So, in the meanwhile, if you have any other queries, you can always let us know. You can either ping us here, or we are on Facebook and Instagram, the same Aesthetics Plus Clinics. And you can always get in touch with us, and we can also help you out with all these issues and any other queries that you might have. And keep watching our channel for the latest updates on what is happening in the world of cosmetic surgery and aesthetic surgery in Bangalore in India. So this is our first live session. So hopefully we might have more sessions and we can have more interactions later. So all the best. Cheers. And once again, to all the mothers out there, happy Mother's Day. And